Yes. Hi guys, it's Dr. Raj Banerjee again, and I want to share with you another case study. And you know, the way I take my case studies on my cell phone, so it's not scripted or anything like that. This is Bridget that I want to talk to you about. She came to me with diabetes. You know, she wanted to learn how to reverse it. Her doctors obviously had no clue how to reverse it. And she wanted to lose some weight. When she came to me, her A1C was a 7.9. So if you guys know anything about A1Cs, that's pretty high numbers. This is when you can get complications of diabetes, kidney issues, blindness, you know, heart issues and things like that. And within about 3 months, we were able to go from 7.9 to 5.5. At the same time, she's getting off all her medications. She was very excited. And so here's her story. And another thing, let me kind of point this out. This is really what's exciting. Usually her doctors would just maybe spend 10, 15 minutes at the tops talking to her. When she brought the lab test, the before and the after blood test, and went from 7.9 to 5.5, her doctor looked at her and said, pulled herself towards her and said, "What are you doing?" Okay, so I'm really excited about this case study. So here it is.
I was diabetic, and from the time I found out I was diabetic, I was more. But it didn't seem to matter whatever I did, I was still diabetic. I could get my blood sugars down through medicine, but it never went away. So then my husband got very sick. He had cancer just out of the blue, and within 6 months he passed away. And I told myself then I just could not do that. I just couldn't let something that I knew about affect me and perhaps kill me. So I decided to come to Dr. Banerjee. One of my daughter's friends suggested him, mostly to lose weight, but that was not my goal at all. That was just a bonus. I came and listened to the lecture one Saturday and decided that this was definitely something I wanted to do. It has to be something in your mind to do. And I decided I was going to do it. Within a few months, I got new blood work done, and I had gone from a 7.6 A1C.
I think it was 7.9.
7.9. 7.9 is even better. To 5.5. Well, I was on medicine and slowly could go from two pills a day to one. And it wasn't until I had my blood work that I realized that I had been healed. And that's what I say. I'm not diabetic who's watching their diet. I am no longer diabetic. So usually when I go to my regular primary care doctor, he comes in, he's really nice. He comes in and he says, you know, how are you doing? He asks about my oldest daughter because he really likes her. She was a good patient of his, and she's now gone to Virginia. So he asked about her, and she was fine, and we just usually have a conversation. He checks my vitals, and then he tells me he's going to send me for blood work, and he refills my prescriptions. And usually that's it. And he's usually in a hurry. But this time, after having blood work done through him, he came in, he sat in his chair, he pulled himself close to me, and he just kind of looked at me for a couple of seconds. And he said, "How did you do this? What diet? What did you do?"
So you do recommend this program for other people?
Most definitely.
Please make sure you like my video and also subscribe to my channel so I can continue to make these kind of videos for you. Your support is appreciated. Leave a comment down below letting me know what kind of other videos you'd like to see so I can make them for you. Thank you so much, and please visit my site, getleantoday.com.